This place will go on for many, many years till we've eradicated fistulas, till every woman in this country is assured of a safe delivery in a live baby.
Eleanor Catherine Nicholson was born in 1924 and raised in Sydney. After graduating from the University of Sydney Medical School, Catherine met Dr. Reginald Hamlin. They fell in love, married, and later embarked on the adventure of their life, accepting a 3-year contract to work as obstetrician gynecologists in Ethiopia. On the evening of their arrival, a fellow gynecologist told them, "The fistula patients will break your hearts." The Hamlins had never seen an obstetric fistula case before, and there was little treatment available in Ethiopia. 1 week later, they encountered their first patient, a 17-year-old girl who had endured an obstructed labour for 5 days that tragically resulted in a stillborn baby and incontinence. To their horror, they discovered this was a common occurrence, especially in remote areas where access to healthcare was difficult.
Welcome to the hospital. What's your name, dear?
Initially working from the Princess Tessai Memorial Hospital in Addis Ababa, Catherine and Reg refined the surgical technique to close obstetric fistula injuries. And within the first 3 years, they had operated on 300 fistula patients. As news of a cure spread, many more women came seeking treatment. To cater for the increasing number of patients, Catherine and Reg began fundraising and opened the Addis Ababa Fistula Hospital in 1974, devoted solely to fistula surgery. Catherine and Reg's Hamlin model of care was becoming well known, a model of care that is grounded in a fundamental respect for the patient and a commitment to provide complete and compassionate care.
She's a wonderful surgeon, but she also has such a human touch. And she personally will go out of her way to care for women, to touch them, to talk to them. It's every woman is an individual in her eyes, and I think she makes the women feel that way.
To this day, when a woman arrives at a Hamlin hospital, she is embraced with love and is given nutritious food, a handmade blanket, and clean clothing. A customised program is made for her that includes physical therapy, counselling and rehabilitation, all free of charge thanks to generous donors.
At first I thought, I can't possibly manage on my own.
In 1993, Reg Hamlin passed away from cancer. The idea of doing this work alone was overwhelming, and Catherine was faced with a hard decision: stay in Ethiopia or return to Australia. One day, a longtime friend and colleague, Baru, offered Catherine some support.
And he knelt down beside me and he took my hand and kissed it. And he said, "Don't leave us." He said, "We'll help you." And this really touched my heart so much, I just burst into tears to think that he would want me to stay on and that he was going to be a support, and it was really extremely touching.
With the help of donors who continued to raise funds and comforted by her Ethiopian family, Catherine carried on, dedicating her life to the women of Ethiopia. She went on to establish 5 more Hamlin fistula hospitals across Ethiopia. Catherine always believed that treating a patient is about treating the whole person, not just the injury. Hamlin's Destamenda Rehabilitation and Reintegration Centre is a place where women can heal physically and emotionally. Women are provided with education, vocational training and support so they can return home with dignity and independence. Catherine also knew that to eradicate fistula forever, these injuries must be prevented in the first place. The Hamlin College of Midwives trains students in a 4-year midwifery degree, then deploys them back into their villages where they provide vital care to rural women, preventing fistulas and saving lives. Many years ago, in 1962, 16-year-old Mamitu Gashe was carried into the Princess Tessai Memorial Hospital, close to death, with horrific childbirth injuries. After receiving life-saving treatment from Catherine and Reg, Mamitu decided she must stay at the hospital and dedicate her life to helping women like her. She worked and trained alongside the Hamlins and went on to become one of the world's most acclaimed fistula surgeons. Mamitu is operating again today. In 2020, at age 96, Catherine Hamlin passed away on the grounds of her Addis Ababa Fistula Hospital. She planned for her hospitals to continue long after she was gone, and the team at Hamlin Fistula Ethiopia have not wavered. With your support, they are working hard to find and treat every last woman suffering with a fistula injury, and to realise Catherine's dream of eradicating fistula from Ethiopia. Today, Hamlin Fistula Ethiopia is a healthcare network comprising a world-class surgical team and over 550 Ethiopian staff servicing 6 regional fistula hospitals, Destamenda, the Hamlin College of Midwives, and 80 Hamlin-supported midwifery clinics. Hamlin is the leader in the fight to eradicate obstetric fistula around the world, blazing a trail for holistic treatment that empowers women. With your help, we are continuing Catherine's journey. We won't stop until we have eradicated fistula from Ethiopia forever.